As you know, today is World Hunger Day. The Hunger Project founded World Hunger Day in 2011 to bring attention to the most pressing issues in the fight to end world hunger. Right now, today, one of the top priorities for creating a world without hunger is to address maternal and early childhood malnutrition. Malnutrition causes a vicious generational cycle of hunger where maternal nutrition has a direct impact on the health and nutrition of her children. It affects every country in the world in one way or another. People either have too much food, not enough food, not the right foods with the right balance of nutrients, and more. It's also being driven by a number of issues. One of them being the cost of food. Here in the United States, we've seen this continue to rise. For many people around the world, it's been high for several years and hasn't come back down. According to the latest Status of Food Security and Nutrition report, more than 1.3 billion people in the world, or 42% of our population, were unable to afford a healthy diet. And that data was from 2021. And we know that the price of food inflation has continued in many places around the world for key crops and staple crops. So it's a really big issue in a lot of communities. We've also been seeing a rise in conflict that is causing malnutrition, and of course, climate change as well. And one of the other key points about malnutrition that I want to drive home today is the outsized impact that it has on women and girls. Around the world, when food is scarce, families choose to feed their sons first, and fathers in the family eat first as well. Girls and women are often the ones who are eating last, they're eating the least, they're eating the scraps from the plates that were kind of left from the fathers and the sons. And according to UNICEF, more than 1 billion adolescent girls and women are suffering from malnutrition today, 1 billion people. And this is particularly concerning for two reasons. One is that malnutrition can widen the gender gaps that we're already seeing in schools, in workplaces, and the economy, which is perpetuating gender discrimination and entrenching gender norms. And two, malnutrition has very negative effects on pregnancy. A malnourished woman is at a high risk of complications throughout her pregnancy. As the baby grows, it's unable to get all of the nutrients it needs to thrive after it's born. And after giving birth, malnourished women often struggle with breastfeeding, which in many cases leads to childhood malnutrition for the baby. And those first 1,000 days of life is a crucial period of time for babies to build the foundation of their lifelong health. And too often we see mothers who are grappling with malnutrition themselves. They're unable to give their children everything they need. And I know that sounds like a lot of doom and gloom to start out the webinar with, but I have good news, and that is that we can end malnutrition. By making the right investments in the nutrition of women and children, we are able to break that generational cycle of hunger that it creates. So I'm really excited to have with me 3 experts who are here to talk a little bit about what these investments look like and how we can end malnutrition around the world. So first, let me introduce Dinesh, the lead of advocacy and communications for Action Against Hunger in South Sudan. With over 10 years of experience in strategic communication, he is a seasoned advocacy expert specializing in the political and humanitarian landscape of South Sudan. He's hosted 2 major UN radio programs and serves as the co-lead for the Lobby and Advocacy for the Right to Grow Consortium in South Sudan, the Mutual Capacity Development Consortium lead, and the communication lead for Right to Grow. He's a busy guy. Next, Maria, Vice President of the Strategic Partnerships at Adizia, a nonprofit organization that's dedicated to the treatment and prevention of malnutrition for vulnerable people in the developing world through the manufacturing of a range of fortified peanut-based, ready-to-use foods. Maria works very closely with many international institutions and NGOs involved in nutrition programming and has followed shipments to Guatemala, Haiti, Niger, Ethiopia, Sudan, and Sierra Leone. So great experience that she's bringing to the table. And finally, my colleague, Grace Chikawi, who is the country leader of the Hunger Project in Malawi. Grace is a trained nutritionist and practiced at one of the top referral hospitals in Malawi before she decided that she wanted to work with women in rural communities to prevent malnutrition before it brings them to a hospital setting. So to kick us off, Dinesh, could you give us a little bit of an overview of maternal and early childhood nutrition in your country? And what are some of the barriers that women in South Sudan are facing to maintaining proper nutrition?
Thank you so much, Anna. Thank you, our dear audience. Yeah, thank you. And again, welcome. Greetings from South Sudan. Yeah, Anna, as you were going through your openings, it was resonating with what exactly happens in South Sudan as well. The gum rates in most of the counties and states in South Sudan are really, really beyond what is really, really expected to be. The maternal child health rate, mortality rate is quite high in the country as well. And this has been, there has been push and pull factors to this as well, of direct malnutrition as well, but then also the underlying causes of malnutrition as well. So in all, there is really, really very high rates of malnutrition in the country. And organizations and humanitarian sectors have tried to do their best, but there is a lot that needs to be done, both to address the actual malnutrition, but then also the underlying causes of malnutrition as well. And we are trying to push with the current project of Right to Grow to address more of the underlying causes of malnutrition as well. A lot of work has really been done in terms of treatment. Treatment has been the biggest work, especially for the UN, but also for the big national and international NGOs as well. But the issues of controlling, the issues of prevention has really not been taken very serious, and that is what we really are working so hard to pick up. Thank you, and over to you.
Thanks. Grace, could you give us a little overview of what it looks like in Malawi?
Yeah, so in Malawi, yes, malnutrition, especially for the children under the age of 5, is quite high. And we're implementing a couple of interventions, and that's organizations, non-profit making organizations, as well as the government has put up in place strategies to address malnutrition. However, the efforts that are being put in place are also being challenged by the effects of climate change, such that you find that you make gains in a certain period, and then sometimes flooding occurs, and then all the gains that you were counting on have been put back to zero. So you start, and then you start with the response, like rescuing people in the emergency time, rescuing them from the flooding areas, providing relief items and all that. And then you restart rebuilding their resilience, and then they face again things like drought. So like for Malawi this year has been both flooding in some parts of the country and dry spells in some parts of the country, such that being a country that's dependent on agriculture for its nutritional needs, it is quite challenging to meet the nutritional needs of the populations.
Yeah, and that brings in the perspective from Adizia, I think, which is the plumpy nut or ready-to-use foods, which can be used in both crisis situations, but then also to treat chronic malnutrition. And Maria, could you share a little bit about how the products that you all create do that, and a little bit of your global perspective on malnutrition as well?
Sure, and a pleasure to be sharing the panel with you both, Grace and Dinesh. So Adizia is a nonprofit. We specialize in manufacturing ready-to-use therapeutic and supplementary foods, which we're always working in partnership with UN agencies, USAID, and then the implementing partners on the ground to deliver them primarily through community-based clinics and community health workers. I like how you started, Anna, by saying we can end malnutrition, because we can. The numbers, looking at the global picture first, we see about the prevalence rate of severe acute malnutrition is about 13.6 million kids at any given moment in time. And then if we look at the GAM rate, which is what Denise was talking about, the moderate and severe, that's about 45 million kids at any given time. So those are big numbers, but it's not hopeless at all because we know exactly how to treat these children, and there are very effective protocols that involve both a product, but also a protocol, like a system for community-based management. So over the last 15 years that I've been in this work, we've actually been seeing these numbers go down. Until the pandemic, we saw them go up again. And we used to talk a lot about the 3 C's, like COVID, conflict, and climate change. So COVID was a big factor. It's less now, but still conflict and climate change are 2 of the biggest driving factors for why we're seeing tweaks up in malnutrition. All that said, it is preventable. And 2 years ago, the US government put an extra 200 million specifically toward RUTF. And then that multiplied by other states and private donors became about 600 million that was just dedicated to treating severe acute malnutrition. And in the following 12 months, we doubled the amount of children reached and we lowered child deaths from acute malnutrition. So now we're in a moment where we need to sustain that momentum because we know we have a very strong evidence that when we do have extra investment, it allowed the programs to scale up, it allowed the product to scale up, and not just supply from the United States, supply as well from local producers all around the world. There is a local supplier in Malawi, Project Peanut Butter. There's also a supplier, there was a supplier in Sudan. They're temporarily in Egypt now, and they were sending supplies also into South Sudan. So the global picture is serious and very sobering, but also very hopeful because we do have solutions that we know that work very well for moms, for babies, and also for moms, which I know we'll talk about soon too.
Yeah. Dinesh, the Right to Grow program has a strong emphasis on that community-led advocacy to advance the nutrition within rural communities. What are some of the successes and the breakthroughs that you've seen in this space through your work?
Thank you. Thank you so much. In my work in the field of advocacy in South Sudan, to me, Right to Grow has touched me deep because it is a well thought of program that how do we supplement what is already happening? There is already good work that is happening with the PLAMPISAPs, the RUTFs, the CSB++, which is really, really good. But there's a context like South Sudan where sometimes access could be a problem. Transporting this food to some of these villages could take months. Floods could cut off places, and they started thinking, how can we start to develop some of the local food systems that can be really, at least to supplement, just in case the food does not arrive in time. How can mothers start to use simple things like the kitchen demonstration gardens, plant a few vegetables in their areas as well, and finally burst into fully blast FSL systems where they do crop gardens as well. And then they could really control they could really prevent malnutrition even at the get-go. So all in all, Right to Grow is a project, 5-year project that focuses heavily on advocacy. Right to Grow does not give any food supplies, but it's about mindset. It's about change of attitude. And it takes 3 shapes. The first one is community engagement. The second one is engaging the duty bearers, that is the government. And the third one is to have the stakeholders also on board. When it comes to community engagement, we're talking about more of social behavioral change. How do we talk to mothers? How do they start to breastfeed their kids? How do they change their attitude towards breastfeeding? How do they do exclusive breastfeeding? When it comes to the caregivers, the grandparents who take care of the children, sometimes we are talking about how women are more marginalized as well. But also there are some grandmothers who have been doing practices of adding food into children's diets when they're not like 6 months. And this could be our grandmothers, they could be our aunties. How do we start to talk to them and say we need to have exclusive breastfeeding? We have men-to-men groups. Initially, we were focusing on the mother-to-mother groups, but we also realized fathers need to step on board to also start taking care of children. If a mother has gone in a worst-case scenario to collect firewood to go look for food, how can a father step in? How can we have this working? So this community engagement has been yielding lots of fruits, but it is from advocacy point of view. It's not a combative way, but it's about shedding, see what can we do better? If we do this, what could we see the change that we need? But then also we have also engaged the local authorities as well. The local authorities in terms of providing farmlands for mothers, especially those ones who have been displaced from one place to another due to flood or maybe conflict, for them to also produce food as well. But also to bring about social cohesion as well. How do we create peace? Because one community can come to another community as well and conflict spark. So how do they also make sure that there is harmony as well? So you realize that this community engagement is very crucial, and it is a fabric that holds the society as well. In terms of local community engagement also, we talk about how do they start to put together their voices. The approach of advocacy in Right to Grow is about bridge for voice. How do we have the community voices move from bottom up? How do their voices get to reach the government? Through the structures. So the local government as well feed into the state government that feeds into the national government as well. So this is where our advocacy begins. If the citizens, if the community do not know their rights, how do they get to now speak about their rights? It is initially and it is fundamentally the rights of the government to take care of its citizens. If they are not doing that, how do they start to speak about this? How do they speak about it in a way that does not look combative, but it is expressing the needs on ground? How do we get to talk to this with our national leaders that you also come from a community? And your community, your mother, your father, your brother who is in the community needs the services that you are supposed to provide as a government holder in where you are as well. So that is the first level. The second level is where we engage the government at the different at the different levels of state and at the national level. Here we focus more on the lawmakers. We've done a lot of advocacy. This focuses heavily on policy advocacy and budget advocacy. Since the beginning of the project, South Sudan never had a nutrition policy. And there was no guideline on how you can do nutrition as well. Any organization will just organize its framework and start to do interventions as well. There was no clear guideline. It was somewhat hidden into health policy, and this was the issue that we put forward to Right to Go and said we want to address this, and we feel this could really harmonize how we intervene when it comes to nutrition policy. So the nutrition policy picked up, and we are so happy that the government picked up, the Ministry of Health picked up and supported us, and we did hiring of the consultants and firing of the consultants. There were lots of work that happened in the process as well until we got the right consultant. They moved 3/4 of South Sudan collecting data and then contextualizing it to South Sudan as well. And we also managed to advocate and get big shots on board. The UN came in, UNICEF came in, WFP came in, UNFAO came in, and we all agreed together that we are going to build a very comprehensive nutrition policy. We have materials where even we got members, director generals, and then ministers, state ministers come in and approve this document. So we already at the final stage. The document has been validated, so it's going to the Council of Ministers, and hopefully we will have our nutrition policy out. But then we have had pledges in between where organizations, the government has played that after the nutrition policy is passed, they're going to really go hard and disseminate the policy. So this is around policy. The next one, the next thing that we do with the government is also we do budget advocacy. It has been a painful process. The country never used to take respect of the budget, the budgeting processes, until we started analyzing the budget. So we literally sit down and analyze the entire budget for the year compared to the one that happened last year. And then we present some of the loopholes, especially with regards to issues that affect malnutrition, especially for the Ministry of Water Resources and Irrigation, Ministry of Health, Ministry of Agriculture, Ministry of Fisheries. So we analyze their budget and then present to the government. We say, guys, nutrition is at a higher rate. Now we talk about food security mostly, and we tell them we need more allocations for food security. We've seen allocations grow, and we've also seen when the goal of the budget advocacy was, first of all, to allow the citizens to participate in the budget processes, because initially it was not happening. Then now we can get to actual allocations, then the disbursements. Then after the disbursements, we want them to translate into control of malnutrition in the country as well. But we've already so far achieved. Now the government calls us for the budget hearings every time, and already we are in May, so we're already in the processes. Our budget comes out in July, so we'll be quite busy writing position papers and trying to control and also influence policies and budgets so that we can get a lot of noise in the parliament for more budget for agriculture and food security. And also, we've seen now the communities through training CSOs on budgeting. We've seen CSOs now come on board, and now they're also liking the process, and they realize that for real, we need a budget because we pay taxes. Now that we pay taxes, we need some services. So we've seen this come alive, and we are so happy about that as well.
Liking the budgeting process is a tough one. I know
Yeah.
Maria's done quite a bit of budget advocacy as well.
Yes.
Here in the US and on the global level. So Maria, I'd love to hear a little bit from you. Dinesh will come back and hear a bit more about Right to Grow, but would love to hear, what is the nutrition community really asking for from like the US government, UN entities? I know you've been very involved in a lot of the budget conversations here as well.
Yeah, that's a big question, Anna, but a good one. I think about it in a few different ways. In the big picture, we are advocating a lot more for prevention and not exclusively treatment. That doesn't mean we don't put funds toward treating the most severe cases so that children don't die. No, we do. We absolutely need to have funds toward that. And we have to be dedicating money toward development and other prevention activities that help prevent this in the first place. So Denise, you were just mentioning some, the ag budget, the health budget, all of these budgets are really important. Prevention is all of those things. If we're talking about products specifically, it's also something like SQLNS, so a smaller supplement that goes with a child's normal foods as a preventative. Or if you want to back it up one step further, which we do, is to make sure that malnourished mothers are getting something. So this is often called BEP, balanced energy protein. It's one option for malnourished moms. Sometimes they're able to get CSB or other local foods. The key is really looking at what is available locally and then filling in the gaps for what might not be available locally, but really putting more emphasis on prevention. When we look also, a second area that I think about is leadership of the United States. So I mentioned the example of 2022 when USAID stood up and made a commitment specifically for treating severe acute malnutrition. They put up 200 million and that multiplied to almost 600 million. So when the US takes a stand and takes leadership, others do follow. And so we are asking the US to continue to be a leader in that. We're looking at the Farm Bill. I don't know how wonky we want to get, but it's the US, it's time for a new Farm Bill, and international food assistance is couched inside the US Farm Bill. So we're looking at a few different things. Enough flexibility for USAID to be able to choose the most appropriate and cost-effective avenue is one thing where there's a lot of work. And for us, that also means finding the right balance between supplies that are coming from the United States, which is important as a strong and reliable base, and the complementary supplies that are coming from local and regional areas where it makes sense to do so. So we are often advocating along those lines. And we're also advocating for, when there are high rates of acute malnutrition, that we're putting up more money towards that. That's in a nutshell, but I'm happy to go more in detail in this area.
Great. Well, I think one of the things that both of you have mentioned as part of the advocacy around this is this idea of strengthening food systems and how that can support maternal and childhood nutrition, especially in rural communities. And Grace, I know this prevention side of things is very important to you and is a big part of the work that we're doing as the Hunger Project around the world. So I'd love to hear a little bit from you about what strengthening food systems looks like when it's linked to nutrition programming as well.
Thank you so much. Strengthening food systems is making sure that food is accessible and that those people who need it are able to produce it in the first place on their own. And which is very important, because if these people rely on buying, some of them are so vulnerable to have the financial capacity to depend on buying food, especially in the countries like where we are. So food production is very key, and producing enough food is very important. And today we're talking of thriving world is dependent on thriving mothers. You know, if we don't break the malnutrition cycle now, it means if we have a mother that is malnourished, that mother will obviously have a malnourished child, and that child is not going to go very far with their education because of the effects of malnutrition. And when we're talking of this child not going very far with their education, what we are actually entailing in there is that this child is positioned for early marriages or early pregnancies because they'll feel like they have nothing to do, they can't perform academically. So the only result is for this child also to get married. And then once they get married, you can also see that a cycle of poverty goes around. And we can only break this cycle if we are empowering women. We are empowering women with their with capacity to cultivate their own crops. And we're also saying in here, Sudan has mentioned to say we are affected by droughts. We are affected by heavy rains or flooding. We need to start coming up with strategies to harvest the water that is sweeping away the crops during the rainy seasons. So if we build the community capacity to harvest the water and utilize the water when the flooding has stopped, you know that the communities are going to grow enough crops and be able to feed their communities. So unfortunately, we are not yet established in building those structures where we can harvest water and practice irrigation, and we can grow crops throughout the year without just being dependent on rain-fed production. So it is important for us to start focusing on irrigation facilities in the communities, for us to start focusing on residual moisture utilization, for us to start focusing on those water harvesting structures so that communities have the power against the climate change effects and can control when to grow and what to grow at their convenience. So really, if we start addressing malnutrition through food production, through access to healthy services. So having food is one thing, but also the quality of services that are in the communities also matter. So you're talking of emergencies all the time. You're talking of flooding. During flooding, people need good sanitation. people need good quality water for drinking and for utilization in their homes. So when we're talking of food systems, we should also look into issues of water and sanitation and hygiene. How are the communities empowered to prevent malnutrition by meeting their water, by having access to quality water sources and being able to utilize them accordingly? Apart from looking at the water component, we also need to look at the issues of access to healthy services. We just mentioned here to say during the disaster times, children are prone to diseases. They need, and the moment they suffer from different diseases, it puts them at a risk of malnutrition because they can't fully utilize the food that they are getting. So we need also to make sure that these children have access to quality healthy services. So we're talking of addressing malnutrition requires a holistic approach. We need quality healthy services and access to those services. We need good agricultural production and farming inputs which can help the communities grow locally made food and be able to combat malnutrition. We need those governance structures like proper coordination within the country to say who is doing what, who is contributing to what, and then we all come together collaborating and making meaningful changes to the communities that we are serving. That way, if we do all those issues, we're going to address malnutrition. We're going to have thriving children, not just surviving children. Children are surviving, they're growing in survival mode, but we want these children to thrive. We want these children to become citizens that can grow our economy.
Yeah, I think one time, Grace, you told me that we would never be able to achieve any of the SDGs without addressing SDG 2 or no hunger and malnutrition as the first thing. And I think that's so true. One thing that you all have done is I'm sure, have been working with communities and you've seen the difference between a community that's experiencing high levels of malnutrition and what that community looks like when they receive the protocols and they receive the support that they need to improve that. And I would love to hear any personal anecdotes that you have from working with these communities. What is that change that you see on the ground? Whoever wants to start can go ahead.
Sure, let me start that one because I think it also has my personal experience in terms of what it means to be in a community where you don't have access to services. So what it means if, for example, you don't have a healthy facility in your community, you have to walk 20 kilometers to access healthy services. Definitely, if you are pregnant in that area, you are at risk. So you risk any complications that would come with pregnancies. And sometimes these women risk their own lives just for being pregnant, just for wanting to give life. So access to healthy services is very key. And once we bring in those healthy services, the difference is so significant. We've seen reduced prevalences of these morbidity cases, malnutrition. You know, sometimes a child will be malnourished. Once they access the healthy services, they quickly recover. We're talking of the peanuts here. So if they have access to a service, like going to a facility and they get just that peanut, they'll quickly recover and it will not have long-term impacts on them because number one, it was quickly identified and then it was quickly treated and then they go back to their normal selves. So access to healthy services is very key. It reduces morbidity and long-term impacts of malnutrition. And it also reduces the risk of, it empowers women. Women have more time to do other economic activities in their area because if they're only a walk away to the healthy services, they will not have to walk 20 kilometers and wait at a facility for them when they're pregnant so that they access healthy services. They'll have to go when they're 8 months pregnant and not wait in their 9th month or not wait for their labor to start. So they'll have to wait for labor to start at the healthy facility, which reduces their productivity. Because if they have services close by, they will just move into the facility, just walk into the facility when their labor starts or when they feel like they need to be assisted. So investing in such services like healthy facilities is very key to improving nutrition in general, because that gives them power to grow crops, which is very key to prevention of malnutrition, other than for them wasting time just waiting in a facility for a service or for a delivery, which would come at a day they don't even know. So yeah, it's really great. It results into economic improvements if the community is empowered, the households are empowered, and then the whole community grows economically. The women make decisions because they know they can participate in economic activities, and thereby they can stand up for their rights. They can go and access the maternal healthy services. They can go and do family planning services. Sometimes, you know, people fall pregnant unplanned. And because of that, you find that she was planning maybe a career, but because they didn't have access to family planning services, they are pregnant, and then they have to adjust their future or their plans or their economic growth plans. So it is indeed important for us to have services in the communities and let the communities themselves lead and control what they want to have in their communities in addressing their situations. Thank you.
Yeah, thank you. I think I can go next, right? Yeah. Being the communications person on ground, I get to get firsthand the strategies that have worked for Action Against Hunger and Right to Grow at large. And for South Sudan, and Right to Grow is just one word: multi-sectoral approach to programming. If you go to any Action Against Hunger field location, we don't do isolated programming. So where we will be doing treatment for nutrition, there will be health services, there will be wash services as well. But then how do you ensure continuity if you don't bring in the issues of protection? Gender protection is very, very crucial in this, because we are in a situation or a culture that sorts of, you know, put away women from a lot of services. And it takes a lot of social behavioral change approaches to make sure that some of these things end. And we prioritize, and gender is streamlined across all our programming. So if there is a nutrition service going on, there is a gender component. If there is health, there is a gender component. If there is wash, there is a gender component as well. And we crown it with FSL. So we believe if a child is treated from malnutrition, they've received health services, we need to give them tools. We need to give them hand tools and agricultural tools to produce their own food. This came alive from our meal reports, where we were doing relapse. A child will come to a facility after 6 months, and you're finished treating the child, the same child comes back to the facility. And we realize that, what are we doing? We need to rethink our strategy so that we can have these approaches. And we are so happy that the government has picked up on this approach, and they're trying to make it a practice that we cannot just do nutrition service. We cannot just do health service. We need to embed this. And from testimony, I've seen this translate into bigger farms. I've seen this translate like in Northern Bargazal, where women have gone big on production of rice. And rice now with the flood works together, because initially they were producing sorghum, but now we introduce rice, which is flood resilient. So the rice has really elevated. Now we are now looking about market. We're talking about market linkages. We are talking about large scale production, processing. And these are the kind of transformation we want to see in our communities as well. Our last advocacy that are not put across was the communication with the donors. We've started a lot of interactions with the donors to flex the donor guidelines as well. For example, South Sudan is considered a fragile context where the cash is always emergency, the funding is emergency. And we are saying, yes, we could be having emergencies, but let us have some components of resilience as well. let's have, if said we are going to give us 100% funding, give us a 20% where we are flexible with it, where we can build some resilience with it as well. If you give me $1 million and you tell me to spend it in 6 months, and you give me $1 million and you tell me to spend it in 2 years, the two could be the same funding, but the impact will live long. If you give me 6 months, sometimes I'm stranded to spend it within the 6 months, you know. But if you give me for 2 years, I can plan something and witness it grow in the next month, in the next season, in the next season. And then these are the conversations we are having with the clusters, we are having with the donor communities as well. And these are approaches that are already working. We've seen donor communities committing to this. We are saying, well, we know due to different priorities, we are having fundings being channeled to the different issues that are happening around the world. Can we use the same amount of money very creatively and work together with our communities to make sure that some of these things come alive? So for real, I've seen this happen. I've seen men now, because our culture has never allowed men to work in the farms as well, because of the social protection and then the social behavioral change approaches. We've seen men now grow crops. There is a man that we are championing, and we'll share with you details and links to what he has done. He actually planted onions, and the onions really produced came out like more than he expected, and it coincided with the Sudan crisis, because we used to have onions coming in from Sudan, and all of a sudden he became the supplier for onions in his state, that is in northern Bargazal. And now a lot of men have said they are going to farm, but initially they used to compose songs to mock the guy farming. They were like, the guy has become a woman and stuff like that. So some of this social behavioral change that we are trying to champion, we believe can, first of all, elevate and give more pride to women as well, but also to allow them to step up as well, but also to allow men to start looking at women as equal partners as well. And we believe this together can work to make our societies better. Thank you, Anna, over to you.
Yeah, it's such an important part of it.
Before you come in, Anna, I want to say just a small thing to say, like he's saying, we need to empower communities more. And while we're talking of the importance of crop production, we should also look at the importance of animal production, livestock production. It is also very key and very important in terms of addressing malnutrition. So in situations where maybe the crops have not done well, the community's resilience sometimes is boosted by having those livestock in their communities. So they can sell some of the livestock and go to an area where there is food available and buy food, and then remain food secure in their household and address malnutrition or prevent malnutrition altogether. So I wanted to emphasize to say, let's empower the communities, because the communities have that ability to build their own resilience. And as a way of building resilience, livestock production is also very key in addressing malnutrition. Thank you. Over to you.
Yeah.
Anna, just 30 seconds. There is something that
30 seconds.
Yeah, what I was about to forget is something, our baby that that is so dear to our heart is the youth engagement. South Sudan is over 74% young people below the age of 35. And we have decided to hold them as our champions. We call them our youth change makers as well. So we involve them at every state, at every level, but this is for the future. We know if we don't involve this youth, these are going to be the young mothers, the young fathers, the young governors who are coming up, the young MPs and they're coming up. So we have made it a point that in every programming that we do with Right to Grow, with Action Against Hunger, we include the young people. And we've seen young men and women who are so vibrant, and this gives me a lot of hope for this country. So the youth change makers as well, I'll be sharing with you their social media pages. Anything, if it is a national day, if it's a campaign, if it's anything, they really go very big. They are full of energy. They make me feel younger, you know. And I am always, when we're having activities with them, I just feel like I need to do more with them. And yeah, the youth champions, these are our babies. And Yeah, that is what I thought. If I had not added, it would be very criminal. Thank you.
It absolutely would have. Maria, would love to hear your story of transformation before we wrap up.
Yeah, so you spoke about like when nutrition becomes prominent in a community, and zooming out kind of in the big picture, kind of the history of how RETF started and moving treatments from faraway hospitals to the community-based clinics. How that, I mean, I'll speak in, obviously every context is a little different, but speaking in generalizations, that is hugely transformative. So prior to Plumpy Nut or RUTF being developed, the only way to treat children who are severely acutely malnourished was by hospitalizing them for 2 to 3 months and providing F75 and F100 therapeutic milks. In a hospital setting, the milks get reconstituted. That's problematic for so many reasons, because families would have to be able to get to a hospital. The hospital has to have inpatient beds. Usually a caregiver has to stay with the child for 2-3 months at a time. And so that becomes an impossibility for so many reasons, right? You've got other children, you've got a farm, you've got a job, you've got whatever, or you just physically can't get to that hospital, or it doesn't have enough beds. So the advent of a treatment like RETF that is ready to use, ready to eat, doesn't need refrigeration, doesn't need reconstitution, was huge because it allowed this community-based protocol. So now severe acute malnutrition is treated in very basic community clinics, overseen by nurses and community health workers. And we really cannot underestimate the importance of the community health worker. And we're happy to see the World Health Organization putting more emphasis and responsibility to the community health worker, really acknowledgement of the community health worker, who is often responsible for a number of villages around that clinic, is often doing active case finding by checking the mid-upper arms of the local children, so doing more proactive work. These clinics are usually much closer, that caregivers, often moms or grandmothers, can access them, and they can get, so they'll check the child. If they are severely malnourished, they will do an appetite test to make sure they can still eat. They will make sure they don't have other complications that need treatment, such as malaria or TB. And then they will send them home with either a 1-week or a 2-week supply to go treat their child at home and come back. In many settings, they also use this as an opportunity. It'll often be like one day where everyone comes to get checked and get their next batch of products. And they'll often use that as an opportunity for education as well. So it might be education about home gardens, might be education about WASH, whatever, and usually all of the above, right? Because so much of it is everything you, Grace, and Anish were talking about. It is so holistic. So that really is empowering. And I've been lucky to be able to see children when they're some of their very first treatments. And it is transformative from the first treatment. When children start to get what they need, the flat affect, the no energy, it changes almost immediately. And parents absolutely come back because they see very real-time changes in their child, and they make sure that they improve, that they're gonna come follow through. But what's next? I mean, we can still do better, right? There's a real push now to have a greater continuum of care. So not only treating severe acute malnutrition at a clinic, but having one clinic that can treat severe and moderate, and also offer something for prevention for the child, even more, offer something prevention for the mother, what she needs, offer integration with other health services, whether that's vaccination or malaria or TB, or there's lots of pilots and things being done in various places that are really exciting, because nutrition is often, it's both an incentive to help improve health visits, but it also then has a positive effect on the health outcomes when you have good nutrition. It is so central. I think you said it, Grace, that you cannot going to achieve the SDGs if you don't have nutrition, because it is so central to everything else. So we're at this very exciting moment where we have this opportunity to really integrate nutrition into health, integrate nutrition into agriculture, and to work toward prevention, so that we want to start seeing less children with SAM and MAM, and we want to have healthy children and moms, and I like that you titled the webinar Thriving Mothers, because it starts there. It starts with the moms and the moms having the right nutrition in the first place, and then it continues from there.
Yeah. I
Yeah,
think
Maria, just to add something on what you were saying, I just saw a nice MWAC, and I just wanted to share with you what we've done with the MWAC. Initially, we used to call it Mother MWAC, then now we called it Family MWAC. And we've trained mothers and families how to use the MWAC tips. So instead of them walking a lot of distance coming to the health facilities, they could first check their children from home. And if they find their children is in the category that needs admission or that needs treatment, then they walk to the facilities. And this has not only been to the mothers, we've also trained fathers, we've trained also caregivers as well. So the family MWAC is doing wonders in South Sudan, especially places where it is hard to access clinics. For a mother to just move distance and find that the child is not sick or does not fall in the categories is quite a pain. So we are trying to escalate that, and the government, the Ministry of Health is very happy with that. Thank you.
Yeah, and I think this conversation and that final anecdote just really show the power of, if you educate women on nutrition, if you educate them and provide a safety net and provide support for them in their communities, then they can thrive and they can create the conditions for proper nutrition for themselves and for their families. So just wanted to wrap up and say thank you to all three of you. Grace, Danish, I know it's late for both of you. Maria, I thank you so much for joining us today. And it's been a really great conversation to just kind of connect those dots between maternal nutrition, what investments are needed, and how that holistic investment can really help communities progress in time. So thank you all so much. And thank you to everyone in the audience who was able to join us today.